I've asked one of our longtime TICA exhibitors, Denise Spraker, who has shown both pedigree and household pets and owned many cats with disabilities, to give us a little talk about how special they are. Denise?
Hi. Again, Reedy said, I'm Denise Spraker, and I'm a registered veterinary technician, have been since 1981. I'm also have a master's degree in radiation biology and have a veterinary technician specialty degree in imaging. I'm very passionate about cats. I have a number of cats myself, and again, part of my job working in a veterinary hospital is to help people with cats with special needs. So I want to go over a few of the conditions that can cause special needs and some of the adaptive technologies that we have developed over the course of my career to help these cats thrive in their homes. Okay. Having an indoor lifestyle has certainly changed the lifespan and the quality of life for our domestic cats. Our knowledge of feline needs and cares are improving all the time. So cats at one point that would not have survived with some of these special needs conditions can now lead very long and fulfilling lives. Okay. Some common causes of disabilities that I often see: we have metabolic problems, orthopedic and musculoskeletal problems, and neurologic problems. And I'm just going to quickly go through those and again try to show you some adaptive technologies that we have to again make the owner's life and the cat's life much better. So some common causes of the cat disabilities that are metabolic are diabetes, we see quite a bit, inflammatory bowel disease, which the triaditis and chronic pancreatitis go along with, kidney disease, heart disease, and we're going to see cancer in all three of the categories we're talking about. Okay. The advent of the continuous glucose monitoring, or it's called a Freestyle Libre, has revolutionized how we treat cats with diabetes. What it does is we implant it in the skin and it monitors the glucose in real time. And there's an app on your phone that tells you what the cat's glucose is. And it charts these beautiful curves which help us determine how much insulin or if insulin is needed for these cats. The other thing these Freestyle Libres can do, if you share the app with your veterinarian can see the glucose at any given time. Absolutely changes. Diabetes used to be very, very difficult to treat in cats.
I did not know you could do it on cats. You know, my mother used to have one of those sets. I didn't know that you could use those on cats.
And
awesome.
we do dogs as well. You
That's
just
amazing.
have to put it where they can't reach it. So you saw in that cat, it was sort of that awkward shoulder spot.
One spot that they can't reach.
Yes, that they can't reach. Okay.
That's awesome.
Inflammatory bowel disease and related GI issues are very, very common in cats. These cats tend to vomit a lot, have diarrhea a lot. Again, nobody really wants to live with a cat doing that. The cat doesn't really want to be doing it. So we've had novel protein and hydrolyzed diets, including in raw diets. Some are low fat. We've also had some immune suppressive drugs come in the market in the last few years. Again, that is just really improving the quality of life for these cats. Very, very common condition. This is a 3D printed, elevated food dish for some of these cats that get these inflammatory conditions. They'll regurgitate and get pneumonia from the regurgitation, and we don't want them, of course, doing that. So we can elevate their food dishes. I mean, just if you can imagine it, it's just amazing what can be created. And I'll show you some of the adaptive technologies that owners have created themselves. Okay, again, specialized feeding dishes for these cats. Sometimes you just need to slow their feeding rate down, again, to help not get that GI system all inflamed. Okay, kidney Kidney disease, another just absolutely we just did one on before I left for the annual on Tuesday in the hospital. This cat has kidney disease, and this is his kidney, and all of this white in the kidney are stones. And those stones, when they travel down that ureter, the tube that goes to the bladder, those stones will obstruct that ureter, and the backed up urine will actually destroy that entire kidney. That's a really good sized kidney, so this cat probably had been obstructed for some time. But they actually will put, this is actually under the skin, so we can sample urine from it, but it's just under the skin, and this runs from the kidney to the bladder, so we just put in another ureter. And most of these cats, if they're stone formers, we call them, will do it in both kidneys. So this is life-saving, absolutely life-saving for these animals. So it's kidney disease. Heart disease. In fact, this is an X-ray of one of my cats. Cat had a 3rd-degree heart block. This is a pacemaker. So again, these cats with these rhythm problems, these cats with heart blocks, we can put pacemakers in. This technology here is a little pad, and you can actually stick it to the back of your phone, and you put both the cat's paws on it, and you get an instant EKG that you can send to your veterinarian right over your phone. Absolutely amazing. So for some of these cats, especially older cats that have some of these rhythm disturbances, it's a consequence of them having the hypertrophic cardiomyopathy, or HCM. So again, a nice tool if the cat is having a lot of rhythm problems. Antiarrhythmic medications are not the easiest medications to get correct, titrate correctly, so we don't want to put them on them if they don't need them. But if suddenly your cat's weak and wobbly, you just put the paws on there if you know that's the problem with your cat, and you can get them back on the medication really quickly. Also a lot of new medications. This is a box of what's called Pemobendin, or Vetmedin is the brand name, that we can put cats on, and these cats that do go into heart failure, we can get them out of failure, and again, really prolong a good quality of life for them. It is, heart disease is no longer a death sentence in cats. Okay, cancer. This is showing a scanner for slides. So you bring your kitty in to see me, and I take a sample of your kitty. I can put it on that glass slide, scan it. The pathologist will have it in 5 minutes, and I'll have an answer in 30 minutes what's going on with your cat. Again, we don't have to wait for them to become so thin and so far along in the disease that the treatment isn't as helpful as earlier. And this is just a picture of a digital picture of one of the slides, and all the cells should look like this. You can see this one looks very different, and that's the type of thing we're looking for when we look at those slides. Okay? Cancer treatments are unbelievable now. We have an oncology department where I work. We have surgeons who are specially trained in cancer surgery. So for some of these solid tumor or bone cancers, we can cure them surgically often. Radiation, and that's what this picture is here. These cats that get, mostly we do radiation. We can do it anywhere, but mostly we do it on these nasal tumors because there's no other way to get to them. And it really shrinks them down. Again, the cat can breathe again. Their quality of life is good. You know, cats, if they can't breathe, don't eat. So it really, really helps them. What is this X-ray? Oh, this cat here had a bone. Well, what it had was vaccines can cause a special kind of tumor called a fibrosarcoma or injection site sarcoma. Sarcoma is not a good name to have in any kind of cancer. And they're very, very aggressive cancers, so we have to treat them aggressively. This actually went to the bone on this cat, so we removed half the pelvis, and that cat could walk, just fine. So Also, chemotherapy has come a long way, and we don't use chemotherapy in a way that we do in people. They don't get sick, they don't lose their hair because we use different dosages. Our goal is to improve their quality of life, give them some palliative relief, but it's not to cure them the same way we do in people. So the side effects are not as bad. Okay, so orthopedic and musculoskeletal causing disabilities, trauma and infectious disease, congenital problems, meaning they're born with it, and again, the cancer surgeries, like I was talking about with that pelvectomy there. Okay, trauma and infectious diseases, probably what I see anyway, creating special needs cats. Very often, cats being the indoor lifestyle, we're not seeing so many of them get hit by cars and having to have an amputated limb because the fracture is so bad, or the fracture is so expensive to fix that amputation is what the owners can provide. The infectious diseases, those upper respiratory diseases in the kittens are devastating. It causes erosion of their corneas and they lose their eyes often. Okay. Congenital, I've got a number of congenital things here. White cats with blue eyes certainly are overrepresented that we see in deaf cats. But I call that the hidden special need because most people, when you tell them when their cat can't hear, had no idea that their cat couldn't hear, and they've had it for 5 years. But we notice it because we drop things and they don't jump. Because we have metal cages and we're using metal instruments. So if you do drop something, most cats react to it, but they just don't react. So, okay. This we've seen, fortunately, we had a breeder in Colorado that was producing these. We call them twisty cats, but they're missing their radius. Sometimes a radius and ulna, so their front legs are twisty. And I'll show you some adaptive strategies. So they basically don't have two front legs. Okay. Microophthalmia, again, to create blind cats. And then you see a lot of these cats on the internet. People call them Down syndrome. Well, cats don't have the same chromosomes we do, but it's a trisomy. They have one too many chromosomes. It's just different than what Down syndrome people have, different chromosomes, same problem. But they have all the characteristics of, say, a person with Down syndrome, that they're a little developmentally delayed and usually have a lot of special needs that need addressing. They don't always use litter boxes properly, all that. We'll talk about some. Okay, neurologic, probably the number one thing I see for neurologic cause special needs for me is trauma and cancer. But cerebellar hypoplasia is something that kittens can be born with if the mother either gets panleukopenia or what's the common name for it?
Distemper.
Distemper, thank you. They get the distemper when the queen is pregnant, or if you vaccinate the queen with modified live. In a lot of shelter situations, they don't know the queen is pregnant, or they just are going to take the chance, because not every cat has kittens with this problem. But I know areas in Texas where the distemper, the panleukopenia, is just, there is a lot of it down there because they have a lot of feral type cats that are loose in the environment that are non-vaccinated. So they have a lot of these kittens that can be adopted and live absolutely wonderful lives as well. And we already talked about the deaf cats being sort of the hidden special need, because cats hide that really well. So cerebellar hypoplasia, they're very wobbly when they walk. Depends on how severe it is. Some cases are more severe than others. They have a swaying movement. They do that you'll see people again post it because it's cute on social media. Cat high stepping. You know, to me that means there's something neurologically wrong with that cat. Jerky movement. They have a very hard time jumping on things. So again, we're going to talk about some strategies to help them. And then the stigmas, which is the vibrating back and forth of the eyes, you know, causes them to not be able to see things, which is, I think, a lot of the reasons when they jump and they miss. It's just they can't judge distances the way your cat can, you know, a cat that does not have special needs can. So deaf cats, I have seen people do the most amazing hand signals with cats, and it's just like anything else you teach your cat. If you reward them when they do what you want, when you put your hand up and they stop and you do your clicker, you make your noise with the mouth, and then you give them a food reward. Cats are very food reward motivated as opposed to praise, sort of like how dogs are. Cats enjoy praise, but it's not as motivating to them as food. So whatever is delicious to them. And you can do this even with hearing cats. Teach them hand signals. And like I said, I've seen owners do some absolutely unbelievable, complex hand signals, and the cat gets it every time. Deaf cats, of course, startle easily because, you know, you come up behind them. I myself am deaf, so I am aware of how startling it is, you know, when you don't know someone's behind you or whatever. And cats are too. Deaf cats, of course, need to be kept indoors. You can use visual and tactile clues with them, you know, to wake them up. At work, if I know I have a deaf cat, I will usually do this to the cage because the vibrations from it will. So when I go in to get it out to do something, I don't startle it. I wake it up. Also creative body language. We've talked about the hand signals, but you know, the cat is watching you all the time anyway, and it picks up on your body cues. Well, use them, right? You know, whatever it is you want to do. But creative body, anything like that, because cats are very visual. Again, this is for a deaf cat, not a blind cat, obviously. Okay. So I've got some devices I wanted to show you that people on the internet have posted, and most of these are the owners created them. There are some websites starting to pop up where you can take measurements of your cat for certain of these devices, and they'll build one to your cat's specs. This is a halo type device for a blind cat. So it's basically like the canes a blind person would use. So again, they don't have to bump into things. Most blind cats adapt very, very quickly to being blind. Again, when we talk about special needs cats, cats don't spend a very long time, if at all, feeling sorry for themselves. They just get on with it. And this helps them to not injure their front of their face a little bit more. And then this is a cat, again, that would have, you know, possibly some either neurologic or orthopedic issues in the back. Cats on carts, we see them all the time. For us, where I work mostly, it's from having to have more than one limb amputated because of cancer. So these carts are, again, they get used to them. It's a little weird at first to the cat, but they get used to them unbelievably quickly. Before they even go home from the hospital, they're tooling all over the place. So. This is a little kitten with the cerebellar hypoplasia, again, because they're kind of wobbly and they fall down a lot. This will help them to get around a little bit better. And, you know, for cats that have either orthopedic or neurologic reasons where they can't get their legs underneath them, this particular owner built a little cart for it. that would also help keep those back legs together. This is a little kitten with the cerebellar hypoplasia, and they're doing a little bit of physical therapy with these cats. These cats actually do well with physical therapy. Cats do. Just like we do, just like dogs do, just like horses do. And they're trying to get the strength because this was a very severely affected kitten, and it didn't have the ability to stand very well at all. So they're strengthening this kitten again to try to get it to stand. I mean, these kittens still play, they're eating. Okay, and again, this is a double amputee here in a cart, and another kind of homemade cart. We've got yet another one in the cart, and this one is supported both in the back and the front end by that particular device. This little kitty here, you can see by the way it's knuckling its paws under. I believe this one's the cerebellar hypoplasia as well. These cats that have these angular deformities, we can splint them. Some of them, we can splint them to the point where we can help them live a much more mobile, independent life by splinting some of those angular deformities, because it gives them that extra structure and support. Physical therapy, we've talked about. This is a cat on a treadmill, and you'll see that they have built the sides up of the treadmill so that the cat can't fall off and have a negative experience. But this cat, I believe, had cerebellar hypoplasia as well. So it has the support on the treadmill. But that'll help strengthen those muscles and teach the body where things should be. Try to get those connections in the brain going. We have another kitty here. This is sort of a tactile balance ball that we use in physical therapy. We do physical therapy where I'm at as well, which is nice. So again, just trying to keep those special needs kitties happy and healthy. These are balancing cups here for a kitty. The big balance ball. We can also do ultrasound, electrotherapy, different things. Again, help strengthen anything that would benefit from strength to again give that cat a good quality of life. Okay. Massage therapy is another wonderful way with these special needs cats to help them feel a little bit more normal. Oh, this kitty is getting electrotherapy as well for a neck injury is what this one looks like. Okay, electrotherapy again for spinal injuries. Again, thankfully we don't see as many spinal injuries as we used to back when we let our cats outside. Cats and cars are not a good combination. And again, another physical therapy slide. Again, helping this cat with support on doing the placement and trying to get those connections from the limb to the brain as strong as you can get them. Water treadmills, yeah. We put cats in them. Not very often, but we do it. And again, it takes the stress off their muscles or their joints to keep them just a little bit buoyant. And to help build those things up. Again, just to improve that quality of life for your kitty. Okay, so the reasons why to share your life with a perfectly imperfect cat. One, you make a difference. These cats, not everybody is emotionally, financially, physically equipped to take care of special needs cats. Again, it depends on the special need. So you really make a difference. These cats, usually if they're in a no-kill shelter, sometimes they'll be there for a very, very long time. It really makes a difference to you and the cat. Be inspired. I mean, there's a community of people who are very, very interested in working with special needs cats, and it's a very uplifting group. You enhance your animal-human bond with the cat because you're spending so much time building that relationship by trying to help the cat. It enhances your bond, and you'll also learn something about yourself. You're going to have to be patient with the cat, with yourself, as you work through these things. And that's my talk.